Hello, welcome to MAR and Medication Training for Supervisors. Please note that this session is not a substitute for Medication Administration 2. My name is Tracy Butler. I'm joined today by Abound's nursing team, Amanda Spriggs and Justin Freeman. Amanda and Justin will be providing you with a wealth of information today. Answers to many frequently asked questions can be found within this presentation. But first, I'd like to offer some housekeeping. This session is offered live and by video recording through Abound's Learning Management System, or LMS. Abound supervisors will receive credit via certification line in OTC, and a participation certificate will be uploaded. Supervisors participating via LMS will be required to complete a multiple choice quiz at the end of the session for participation confirmation. DSPs will have access to MAR and medication training for supervisors video as a resource for supplemental information. Certification is not required, and quiz completion is not required. Every voice matters. Requests for this training came from QP Advisory Board. Specific requests include that QP should have a good understanding of what should be checked on MARs for compliance and what needs correction. Follow up on how to get doctor's orders and side effect information documents, identifying and reporting medication errors, information on how to access resources to understand what medications are used for, how to review PRN medication usage for potential health issues that may need to be addressed, and how to identify proper medication storage when conducting AFL site monitoring. Information today was brought through Abound Policy 125, 126, and 127 regarding medication. We also used our Abound SOP for controlled medication identification and upload. Some resources include the FDA Medication Guide, Controlled Substance Lookup, and disposal resources. We are often asked, why do DSPs have to take medication training? There is a state requirement that all unlicensed staff that administer medication must take a medication course to learn how to give medications the correct way. People are legally responsible for any medication or treatment that they give. The DSPs have to take a test before giving medications. Yes, the state does require that DSPs must show knowledge through written and skill demonstration. DSPs must make 90% or above to complete the Medication Administration 2 training. Today's session is supplemental information. No quiz is required for live attendance. A quiz is required for the recorded LMS version. MAR and Medication Administration for Supervisors has no expiration date. Additional training can be provided upon request. Next up is Amanda Spriggs, who will begin discussion on prescriptions.
Hi, everybody. So for prescriptions, who can prescribe medications? You have a physician, a physician's assistant, and a nurse practitioner. So when a medication is prescribed, the prescription has to have the person's name, prescriber's handwritten or electronic signature, dose amount, dose strength, how often to be administered, so the frequency, and the reason for PRN as needed medication, Tylenols for pain, stool softeners for constipation. The DSPs are trained to make 2 copies of the prescription, one for their files, and give one to their QP. The pharmacist fills the prescription, and then we update your medication administration record, which we'll discuss later on in the training. So what we accept for prescriptions: handwritten prescription pad orders, e-scripts, e-chart approved by or prescribed by, letters signed by the prescriber, pharmacy printouts signed by the prescriber, and a Bound Health prescription medication form, which you'll see on the next slide. We do not accept e-chart entered by, letters, or pharmacy printouts not signed by the prescriber. So this is what a form that you can give to your DSPs. This form I tell all DSPs to take this form to the doctor every time they go to the doctor. I tell them to take their bottles or their bubble packs and write it exactly how it is on the label. So they would do the medication prescribed, the dose, directions to include the frequency and route, reason for the medication, special instructions. So this would be if somebody wants to discontinue a medication or they have to take 500 milligrams with 250 milligrams, that any special instructions, or take it with food. A psychotropic is a medication that helps with behavior or improve mood. So you can either fill that out or they could fill it out or have the doctor fill it out. And then the last column is prescriber initial for self-administer approval. Um, so if the client does self-administer their medications, the doctor would sign there. If they don't, I just recommend people putting NA or putting a line there. They would sign at the bottom where it says prescriber signature, credential, date. This form is good for a year. This form is the physician authorizing to administer over the counter. So these are medications that you would have in your medicine cabinet that people could use. I recommend all DSPs, especially AFLs, to get this form filled out. So the doctor would just put their initials by the ones they want. So if they only want them to have Tylenol, Advil, and Neosporin, they would just put their initials there. At the bottom, they're going to sign credential, date, and their practice name. At the bottom, there is additional signature, and that is if the doctor self approves of self-administer of over-the-counter medications, they would sign it and date it. The right approach, medication rights that every person must know. The 6 rights of medication administration are the right drug, the right dose, the right documentation, the right route, the right client, and the right time. So the right drug, there are 2 types of medications that can be prescribed, ones that are filled by the pharmacy, which are brand names and generics, and then there's over-the-counter medications that can be both scheduled or PRN. So the right drug, you want to compare the medication label with the directions on the MAR. They're going to compare, the DSP is going to compare the labels and the MAR a minimum of 3 times. So when they pull it out of the lockbox, right before they pour it, and then right when they put it back. If the labels and the MAR do not match, you want to the DSP will call the pharmacy and or doctor's office. They do not need to give the medication, and the QP is to be advised. Um, the MAR is not to be signed prior to giving medications. Always sign after they observe the individual taking their medication. So you want to make sure, I tell people there to sign their MARs as soon as they watch them swallow it. Do not wait to the end of the day or the end of the week or month. Right drug, over-the-counter medications, also called OTC. Examples: Zyrtec, Benadryl, and Tylenol can be obtained by the general public without a prescription in a local store. Clients served by Abound Health must still have a written order for over-the-counter medications to be given by the DSPs. The right dose, the correct dose must be given if the desired effects are to be obtained. The DSP should always check to see that they are giving the strength that the primary care provider has prescribed. If you know that, I tell DSPs if they know that their client went to the doctor, or if you know that your client went to the doctor, make sure you ask, did they change any medications? Because sometimes people forget to tell you, so you need to make sure that you ask. They never want to use a kitchen spoon, because always use a medicine cup, dropper, or syringe to make sure the dose is accurate. Right documentation, we'll save that one for later. The right route. The route is the part of the body to which the medication is administered. Meds that can be taken by mouth and swallowed are internal meds. Meds that are applied to the outside of the body, such as skin creams, eye drops, and ear drops, are external meds. By the way, when you use an inhaler, you always want to make sure you shake it each and every time before you use it. And I always tell people to rinse their mouth out afterwards, because if not, then they can get an infection in their mouth and it can be very painful. So abbreviations for route: PO is by mouth, NPO is nothing by mouth. So when somebody has swallowing difficulties, then they could, a lot of times they have nothing by mouth. They could have a feeding tube. If you're not familiar with that, that is a tube that's in their stomach that is used for nutritional supplements, or some people take nothing by mouth and only use the tube. If they do have a feeding tube, it needs to say VT for via tube. SUPP is suppository. OTIC is ear. OPTIC is eye. SQ is subcutaneous injection. So that's usually in the back of their arm and the fat of their belly. The DSP has to meet with myself or Justin to go over that training and that's offered on Tuesdays and Thursdays. IM is intermuscular. So it's usually in the arm and the buttocks or the thighs. SL is sublingual. BUC is inside the cheek. PR is per rectum, and GTT is drops. The right client, they want to confirm the identity of the client prior to giving medications. Usually this is a one-on-one service, but there are times when either residential or group settings where there are multiple people. Right time. Medications are scheduled at regular times to maintain consistent levels of effectiveness. Medications that are quickly used by the body need to be taken more frequently to maintain adequate levels in the blood. Some medications are taken less often due to the body not using the medication rapidly. Medications can be given 1 hour before and 1 hour after their scheduled times. So if it's due at 8 o'clock, you have from 7 to 9 to give that medication. Before giving meds outside the time frame, the doctor or pharmacist must be contacted for adjustments to other doses. DSP must do an incident report, and more to come on incident reports shortly. And so abbreviations for time. So Q is every, QH is every hour, QD is every day, BID is 2 times a day, TID is 3 times a day, QID is 4 times a day, Q blank, so every 8 hours, every 12 hours. HS is hour of sleep, ACs before meals, PCs after meals, and PRN is as needed. So now I'm going to turn it over to Justin, and he will talk about psychotropic medications.
Hello, everyone. So we'll talk about psychotropic medications. Psychotropic medications are medicines that affect or help someone with behavior or improve mood. They're referred to as psychotropic. When administering a psychotropic medication, a pharmacist or doctor must conduct a medication review of all medications every 6 months. If they're an AFL, the DSP is responsible to obtain documentation and submit it to the QP. Other residential and periodic services, the QP is responsible for obtaining documentation. On-target clinical process regarding psychotropic medication will be discussed at the end of this training. Controlled substances. They can be addictive and therefore have more strict federal and state regulations for ordering, dispensing, delivery, administration, and disposal. Controlled substances can be looked up at the deadiversion.usdoj website. Controlled substances must be double locked. An example of that would be a locked box inside of a locked closet. They must be transported in a locked container. Residential services are required to count. The DSP is required to count prior to administration and document on a controlled drug inventory record. If the control count is wrong, then Abound Health must be notified immediately. This is Abound Health's policy for disposal of medications. Disposal of controlled substances must be documented on a controlled drug inventory record. When a medication is disposed of, the following procedures must be followed. The QP must have an order from a currently licensed provider to prescribe medications authorizing the discontinuation of medication. Before disposing of medications, remove all personal information on the labels of pill bottles or medicine packaging. The QP or designated staff should then return the unused discontinued medication to the pharmacist for proper disposal. A note should be entered on the client's Abound MAR, BAC, or controlled drug inventory record when applicable. Record the following information: name of person receiving services, date and time of the disposal or transfer, medication and number of pills, tablets, capsules, or liquid amount, pharmacy the medication was returned to, or the provider the medication was transferred to. Then you'll sign the document. Discontinued medication should be returned to the pharmacy within 24 hours of the medication being discontinued, and we want them returned within 24 hours to cut down on the risk of a medication error. If the pharmacist is unwilling to accept the medications, the following procedure must be followed. The QP or designated staff will take the medication to a safe medication disposal kiosk or site registered with the U.S. Drug Enforcement Administration to collect old, unused, unneeded, or expired medicines, which allow for safe and convenient disposal of unwanted, unused, or expired prescriptions, including controlled substances and over-the-counter medications at no cost. You can find an authorized drug collection site by visiting the DEA diversion.usdoj website. A note should be entered in the client's Abound MAR back if it's a non-controlled medication, or controlled drug inventory record if it's a controlled medication. The data you enter will be the same. This is an example of what a controlled drug inventory record would look like. This example has been filled out to include multiple scenarios. If you're getting a refill, or if you're giving medications regularly, or if you're transferring a dose of medication to another staff. It's just look at the yellow spots on here, and it's filled out accordingly. If you'll notice down at the bottom in yellow on the right side, if you're disposing of a medication on a controlled drug inventory record, a witness is required. It's a preferred that you get a witness from the disposal facility. If they're unwilling to witness, you can use a third-party witness. Just make sure it's somebody you trust. Self-administration of medications. Clients who administer their own medication applies to all residential self-administration and periodic staff who administer during service provision. Must have a physician's order for them to self-administer medications. And self-administration of medication must be specified in the plan of care. Clients who self-administer must also adhere to all 6 rights of medication administration except documentation. The client does not have to keep a MAR if they self-administer. If you're a DSP for a client who self-administers, when the client takes their medication during service time, the DSP will confirm with the client that they took their medication and document SA, which stands for self-administer, on the MAR. If attending an Abound Day program facility, the medication is to be locked at the facility. Abound must maintain correct orders and correct side effect sheets for all clients who self-administer. So now we'll talk about documentation. So medication administration record, or the MAR, is the document to log all medication information for persons served. Encourage pharmacy-generated MARs whenever possible. To set up a MAR, the QP will need a copy of the orders and the medication, or a picture of the label. MAR setup is a good time to do a medication review. Medication review form will be presented at the end of this session. The hour column of the MAR simply tells it what times the medications are to be taken. The numbers across the top indicate the days of the month, and initials indicate who administered the medication. All initials on the MAR must be identified by a signature, and in some cases, other information may appear below the initials. So this is an example of what the front side of the Abound Health MAR looks like. And this is what the back side of the Abound Health MAR looks like. If you'll notice, there's 3 sections on the back side of the Abound Health MAR. The first section is for disposal of medications, and this is for non-controlled medications. Controlled medications must be disposed of on a controlled drug inventory record. The middle section has a spot for refusal of medications. If your client refuses a medication, you can document it here. And the last section is for documentation of over-the-counter PRN medications and filled by the pharmacy results response to a medication. At the bottom of the page, there's a line that DSPs must sign at the beginning of the month and date at the end of the month. If you don't document it, then you did not do it. So if you give a medication, make sure you're signing for it. If you don't sign for it, it looks like a medication error that you did not give the medication. So if you don't document it, then you did not do it. Never sign the initials of another staff. Only sign for medication that you gave. MARs are legal documents and can be called into court. And before administering medication, check that the current month and year is entered on the MAR. Also check to see if there's more than one MAR page for the individual. Use black ink only. That's the only color ink authorized for use on a MAR, so no blue, green, pink, or any other color. Use black ink only. If an error in charting occurs, draw one line through it, date, and initial. So that's the only way that you can strike out anything on a MAR. Draw one line through it, date, and initial. Never use whiteout, pencil, or scribbling. So a late entry procedure. A late entry procedure is for when you give a medication on time, but you don't chart it on the MAR till later. So it's a late entry. So what you're going to do is initial the box with your initials because you gave the medication on time. Then you'll circle your initials in that box and write a note, late entry, on the bottom of the MAR. Sometimes medications are titrated. This means they're increased or decreased over time, and the QP is to be contacted for specific MAR documentation instructions. So this is an example of how to update a MAR for a discontinued medication. Just remember that always you need to get a written DC order or a DC prescription before you can discontinue a medication. What you're going to do is document the day the medication was discontinued, draw a line through the remaining days so no one will use that area. And the QP and Guardian is to be notified of the change immediately. The QP is to be provided with a copy of the discontinue order, and the DSP is to keep a copy for their records. This is an example of how you would add a medication to the MAR. Document the date the medication was ordered. Draw a line through the prior days so no one will use that area. QP and Guardian to be notified of the change immediately. QP is to be provided with a copy of the discontinue order, the new medication order, and the DSP is to keep a copy for their records. So this is how you would document a filled by the pharmacy PRN medication. Filled by the pharmacy PRN medications are required to be kept on the front side of the MAR. For this example, we're going to be using Xanax. So what you're going to do is record the date and time of the initial dose of medication. You can see on this example that from the 1st through the 4th, the client did not need the medication. On the 5th at 9 a.m., they had a panic attack and the care provider gave a dose of their Xanax. They recorded the time and date of the initial dose. The MAR must list the reason on the front with the drug, dose, and other instructions. That will be located over in the medication box where Xanax is listed at. So you have the drug, Xanax, the dose, 2 milligrams by mouth, every 6 hours as needed, reason, panic attack, and additional instructions up to 3 times per day. Also, in 30 minutes to 1 hour, document the response of the medication each time the medication is given. So on the 5th at 9 a.m., when that DSP gave the medication, by 10 a.m., they should document a response to that medication on the back side of the MAR in the PRN section. Only give if the person needs the medication. So this is a PRN medication, not a scheduled medication. And for this example, you would only give the Xanax if the person had a panic attack. Documenting over-the-counter PRN medications. Clients served by Abound Health must still have a written order for an over-the-counter medication to be given by DSPs. The back of the MAR has an area for documenting over-the-counter medication. If the over-the-counter PRN medication is administered frequently, medication can be listed on the front of the MAR. Documentation must include the medication given, date given, time given, reason given, and the person's response to the medication on the back of the MAR.
Hi, guys. We're going to go over, so what if an individual refuses medication? The DSP wants to accept refusal initially and wait 10 minutes. offer choices. Do they want to take it after they finish their breakfast or with apple juice instead of Gatorade? So you give them choices. Continue to offer the medication throughout the time allowed, which is an hour before and an hour after. Remember to use praise throughout the medication process. Once refusal continues past the time, call the pharmacist or doctor's office, follow and document their direction. So that's what the DSP does. Some QPs do it too. The QP is to be notified. Document that the medication was refused on the front of the MAR, noting a refusal with an R, and it's also going to go on the back of the MAR. Document as an incident report. More to come on that very soon. So medication errors are any violation of the 6 rights of medication administration. So the wrong client, the wrong medication, the wrong dose, the wrong time, the wrong route, and the wrong documentation. So daily dose pill boxes are not allowed. So either the Sunday through Saturday things that you pre-fill or the AM and PM boxes, those are not allowed. Why? Medication rights, risk for errors with multiple providers / DSP, and it's prohibited by the agency. There are places that do bubble packs, which I highly recommend. These are more of your small hometown pharmacies. So when an error occurs, the DSP is to notify the QP immediately, complete an incident report, learn from your error. Remember, by reporting the error yourself, Abound is able to help you resolve any problems for you and the person that you support. So medication error, so incidents. So any of the following are considered medication errors: missed dose of any medication, any doses of a medication not given to the client. This does not include a refusal. Wrong medication, any dose of a medication that does not follow the prescribed order. Dose preparation error, medication is not mixed properly. Wrong time, any dose of the medication not given within 1 hour before or 1 hour after the prescribing dose time. Wrong administrative technique, medication is given improperly, such as oral instead of via rub into the skin. Dose given to the wrong client, someone's medication given to someone else. Wrong medication, any incorrect or expired prescription medication administered to the client. Loss or spillage of medication, pills are dropped or lost, liquid medication is spilled. Refusal is missed dosage due to the client's refusal to take the medication. So incident reporting: in the case of any medication error, the client's physician or pharmacist should be notified of any medication error as required by the 10A and CAC 27G. The physician, pharmacist, physician's assistant, or nurse practitioner should determine the level of threat to the client's health and determine the treatment required, if any. If the physician or pharmacist indicates that the medication error does not threaten the client's health or safety, document the error as a level 1 incident. Errors that threaten health and safety are a level 2 incident. Documentation should indicate the type of error, name of the physician or pharmacist consulted, their statement about the error, the date and time of the contact, and the name of the person making the contact. All right, so this is in the IRIS manual. This helps you understand incident levels and which level they are. So you can find that in the IRIS manual. So observe and report. The DSP and QP role is to observe, look for any changes, then report your observation to the doctor. Doctors rely on caregivers to report observations because they see the clients maybe once every 3 to 6 months, maybe once a year. Discuss any questions or concerns you have with the doctor. Medications affect people differently. So some antidepressants make people more depressed. Iron makes people constipated. So make sure that you speak up and say something. Develop a keen sense of observation. Is there something different than their typical appearance or behavior? So the effects of medication, desired effect is what the medication is supposed to do. Vinegar reduces nausea. A side effect is effects produced by the medication other than the one it's prescribed for. Vinegar causes drowsiness. It is a rule as well as a bound policy to keep the pharmacy generated medication education, aka side effect sheets, for each medication in the person's chart. If lost and not replaceable by the pharmacy, the FDA medication guide, you can find it by visiting this website, or drugs at FDA link here. So an adverse side effect. So if you or the QP or the DSP observe and undesirable side effects, you report it. If you provide hourly services, tell the QP and AFL, DSP, or the guardian. The guardian can choose to contact the physician and discuss with the individual. If you provide AFL services, tell the guardian, prescribing physician, and the QP. AFL must contact the prescribing physician unless the guardian wants to contact the physician themselves. The guardian may instruct AFL to discuss with the individual. Document the report, the side effect, and who you reported it to. So you are important. Without you, an individual may not receive medical attention. Medication may be prescribed that the individual is allergic to. Medication may be dispensed by the pharmacist that is not intended for the individual. That's why you always check the MAR and compare with the pharmacy label 3 times. So when they pull it out of the lockbox, right before they pour it, and right when they put it back. An individual may receive the wrong medication. An individual may suffer from undesirable, even fatal medication effects unless you observe and report. So storage of medication, internal pills and external must be stored separately. Each client must have his or her own bin of medication. External meds such as nose sprays, ear drops, inhalers must be stored in an upright position in a separate bin or container and should be stored in the original box or bag he came in, because a lot of times they do not put the labels actually on the creams or inhalers, so you have to have the label. Topical meds must be stored in a separate bin or container and must be stored in the original box or bag it came in. Refrigerated meds must be in a locked container. Community rules still apply. Separated in a locked box and /secure. Can ask for a second bottle to have a pharmacy label or a pharmacy generated individual packaging. Cannot use the pill box. So if they're out and about, you have to have it stored in the bottle, or you can use a bubble pack. There are pharmacies that do the medications in a little baggie that has the name of the medication. Those are okay. Considered like a bubble pack. So remember to keep it current. Check the labels. Make sure the medication is not expired. If it's expired, get a new one. So I'm sure if you go on all our medicine cabinets right now, we all have some expired medications. Expired medications pose a health and safety risk to our clients, and they are cited by state and federal regulators.
All right, so injections. EpiPen use is reviewed in medication administration too. DSPs may not administer any other injections based on the training they receive in medication administration too. Some staff receive additional training for insulin injections. Insulin training is a separate course. The QP is to be notified if injections are ever prescribed. EpiPen. It stands for epinephrine. It is a synthetic hormone called adrenaline. Epi injections are used to treat severe allergic reactions known as anaphylaxis. Call 911 after epi administration. The effects of epinephrine may wear off after 10 to 20 minutes, and further treatment and observation will be required. If an individual has an EpiPen, it must be accessible to the DSP at all times. During the medication administration 2 training, a video is reviewed on EpiPen and anaphylaxis. Now we're going to go over a MAR practice scenario. So DSPs will practice MAR completion during the training. As part of the training, DSPs use the next 2 slides to fill in a MAR with the appropriate information based on the example scenarios that follow. So this is a script that the trainees are shown. This script is an example e-script that may be sent from a doctor's office to a pharmacy, and this particular one is for Tylenol 325 milligrams. Take 2 tablets by mouth every 4 to 6 hours as needed for pain or fever greater than 101 degrees. So this is for your over-the-counter PRN medication. This is an example picture that DSPs are shown in Med 2 for the medication they should pick up with that prescription. Our scenario is called Christmas with Gary West, so we'll go through this. This is what DSPs are trained on for documentation of their over-the-counter PRN medications. So at 7:30 a.m. on Christmas morning, and Gary complains that he doesn't feel well. He says he feels hot. You check his temperature, and it's 103 degrees. What can be given? So we had our prescription for Tylenol, so we're going to give him Tylenol. And what needs to be evaluated again and when? So at 7:30 is when you give the medication. You must chart a results or response to that medication within 1 hour. So at 8:30 a.m., we're going to check Gary's temperature and chart the results. Around 1:30 p.m., Gary's temperature is 102 degrees. What do you do? So we're going to give another dose of Tylenol since it is now 1:30 and the first dose was given at 7:30, and we can give that medication every 4 to 6 hours. What do you evaluate and when? So at 2:30, we're going to check Gary's temperature again and chart the results. Gary is still not feeling well, so he decides to go to bed at 8:30 p.m. After taking his Prevacid and HCTZ, his temperature is 102 degrees. Document on the MAR how you would address his elevated temperature. So this is the PRN section on the back side of the MAR. As you can see, it has the medication given, date given, time given, reason given, and the person's response to that medication. Those are the 5 things that have to be documented on for an over-the-counter PRN medication. In the first section, you can see the medication given was Tylenol 325 milligrams, 2 tablets. So we gave that 3 times. We documented the date we gave it. We documented the times that we gave it. We documented the reasons that we gave the medication, and also the response to that medication an hour after we gave it. So this is how you document your over-the-counter PRN medications on the backside of the MAR. Gary goes to the doctor December 26th. The doctor discontinues his Prevacid, so we have a DC order for Prevacid and sends an e-script, which is shown below. Fill in the information on the MAR. And if you'll notice that the e-script says Prilosec 20 milligrams, take 1 capsule POQAM, which is by mouth every morning. And we're going to use that portion of this e-script to fill in the medication portion of the new medication on the MAR. So this is what you would do. You would fill out the MAR to look like after you receive those orders. So you had a discontinue order for Prevacid. So you go to the 26th where the medication was discontinued. So you draw a line through the end of the month and write DC and the date. That medication has been discontinued. For the new medication, this line is going to be blank, so the DSP will have to fill in this on their own. So they need to know that in the medication box, they're going to fill this information in exactly as it appears on the order from the doctor's office. So you have Prilosec, 20 milligrams, 1 capsule each morning by mouth. This client takes their morning medications at 8 a.m., so you put 8 a.m. in the time column. You draw a line from the 1st through the 26th because that's when the order was written. Then you write new orders and the date. On the 27th at 8 a.m., when you give that medication, you'll put your initials in the box and continue to do so each morning thereafter. This is a medication review tool. You can use this to audit your medication. So you'll look at your MAR and the orders that you have from the doctor and compare them, make sure everything matches. And the top part of this sheet you'll use to make sure your MAR is formatted correctly. Down at the bottom, if there's a controlled medication, you'll use this section to audit your controlled medications. This is the tab for MAR and script comparison. So you'll compare the medication to the orders from the doctor and what's on the MAR, and everything should match. Upload into OnTarget. So clients that take medications, this is for APs and QPs who are uploading information into OnTarget. Clients, search, history, consents, and medication orders. MAR upload review tool. So your MAR upload and your review tool is going to take place on the 15th of every month. You're going to upload the MAR and the review tool as separate documents. So you'll upload the MAR and then the review tool in the same place, but as different documents. Health skills training orders only add if the client requires health skills trainings. Is the consent line required for all? If the consent line does not, if the client does not take medication, consent line for the annual 6-month med review. Description, some combination of that. Date out 1 year and confirm again with the next plan year. So you can see below a snip of some examples of that. If you need some help or require any additional training, please contact your PD or Sarah Jane. If there are any questions, please conduct those to your nearest supervisor. And this is the training link that will be provided for DSPs who take Medication Administration 2 to take their test. And that's the end. Thank you for your participation in today's MAR and medication training for supervisors.